What if a diabetes drug could also lower the risk of dementia? Welcome to Science My Health, your channel for health and research information. GLP-1 medications are widely used to treat type 2 diabetes and support weight loss, but new research suggests they may also help protect the brain. A large analysis published in JAMA Neurology looked at whether certain diabetes drugs in the GLP-1 class are linked to a lower risk of dementia, and the results are raising important questions about brain health and aging. Here's why dementia and diabetes are more connected than you might think. Dementia affects millions of people worldwide, and diabetes is a known risk factor. High blood sugar can damage blood vessels, increase inflammation, and reduce blood flow to the brain. Diabetes is also linked to stroke, which raises the risk of vascular dementia. Because diabetes is so common, researchers are especially interested in treatments that might protect both the heart and the brain at the same time. So, how might GLP-1 medications help protect the brain? GLP-1 receptor agonists help control blood sugar by increasing insulin release, slowing digestion, and reducing appetite. These drugs are already known to lower the risk of heart attacks and strokes. Scientists believe they may also support brain health by improving blood vessel function, reducing inflammation, and possibly protecting brain cells from damage. Animal studies have suggested these protective effects, which led researchers to examine human clinical trial data more closely. Now, what the research actually found about GLP-1 drugs and dementia risk. Researchers combined data from 26 randomized clinical trials involving more than 164,000 participants, with an average age of about 64. When all diabetes medications were analyzed together, there was no clear reduction in dementia risk. But when researchers looked at drug classes separately, GLP-1 drugs stood out. People taking GLP-1 medications had about a 45% lower risk of developing dementia. Other diabetes drugs, including SGLT2 inhibitors and pioglitazone, did not show the same benefit. The study did not find strong effects for specific dementia types, likely because dementia cases were rare and follow-up time was relatively short. What this means for patients, doctors, and the future. This study does not prove that GLP-1 drugs prevent dementia. Dementia was not a main study goal, and participants were younger than typical dementia populations. Still, the findings are encouraging. Several trials are already underway, testing GLP-1 drugs in people with early Alzheimer's disease or mild cognitive impairment. If future studies confirm these results, GLP-1 drugs could one day play a role in protecting brain health, not just managing blood sugar. These medications should only be used for the indications prescribed by your provider under their medical guidance. But this research adds to growing evidence that GLP-1 drugs may have future benefits far beyond diabetes and weight loss. Like this video if you learned something new and subscribe to Science My Health for more health research news.